Hi, we're looking at the Discovery Health and Discovery Health Medical Scheme updates for 2021. As we've mentioned, these updates for 2021 are informed by four key trends, namely the medical inflation experienced by the medical scheme, the increased adoption of digital healthcare technology, the focus on improving quality of care for our members, and also the focus on improving access to healthcare for our members. I'm now going to talk about the benefit changes for 2021 that specifically focus on improving the quality of care for our members. And there's a number of very exciting enhancements and changes that we've made and we're going to be speaking about in this short clip. Firstly, around mental well-being. Mental well-being is incredibly important to members of the medical scheme, to clients of Vitality, and in that I include employers as well. So over the years, Discovery has developed quite a comprehensive plan and program to support our members and clients in the areas of mental well-being, and that's across all acuities of care as well as across the various levels of interventions. And it's offered by Vitality, by Healthy Company for employers, and also supported by benefits by the medical scheme. And it spans all the way from promoting well-being through to comprehensive in-hospital care for members suffering acute episodes of major depression or other mental illnesses. For 2021, we've enhanced three areas which are quite important. The first one is for many members that have been in hospital with an acute episode of major depression, there's an elevated risk that they may relapse into an episode of major depression. So we've designed a program called the Relapse Prevention Program, supported by tools for treating doctors, as well as benefits from the medical scheme for the member who's enrolled in this program, and the risks associated with the relapse are then managed through this program, really to the benefit of the member. Secondly, we focused on members who are being treated out of hospital for episodes of major depression to enhance the program that they've got access to. This includes extended periods of treatment, access to a network of psychologists, and also support for their GP and psychologists through expert psychiatrists in the treatment of acute episodes of major depression. And then finally, through Vitality and Healthy Company, we make tools available to employers and to employees to monitor the risks associated with mental well-being. And through the data that we collect here, we're now able to make specific programs available to members that are at risk of developing an episode of major depression. And from 2021, this will include free access to personal health goals and active rewards. This will allow members that are at risk or have been diagnosed with major depression to manage their lifestyle in a way that is complementary to the treatment that they'll be receiving, knowing that a physically active lifestyle and a healthy lifestyle is associated with better mental well-being. The second enhancement that we're making is in the area of the treatment of infertility, which is an issue for many families on the Discovery Health Medical Scheme. And we're quite pleased to introduce for members of the executive and the comprehensive plans that have been on those plans for 2 years. From 2021, they'll have access to treatment for infertility, which includes artificial insemination, in vitro treatment, in a range of centers of excellence that have been accredited by SASREG around the country, and will include 2 cycles per annum. The third element is focusing on addressing the variability of care that our members access. We know that, from analyzing data, especially when it comes to complicated surgical procedures, that often members are exposed to variability in the quality of care that they receive. This is often associated with the setting of where the care is delivered, with sometimes surgery being done in hospitals where the type of surgery is done on a routine basis versus in hospitals where it's not necessarily a routine procedure. And we see clear evidence that where the surgical procedure is done as a matter of routine, that the patient experiences a better outcome. This is the case for joint replacements, hip and knee replacements, and was the basis for the introduction of the arthroplasty network a couple of years ago. And we've already seen significant adoption of the centers of excellence for arthroplasty, as well as improved outcomes for the patients that have had their surgical procedures performed in these centers of excellence. 2 other areas of variability of quality of care where there's significant quality gains to be made by members is in the area of colorectal cancer surgery and also in the area of spinal surgery, where we see a similar pattern in terms of their variability of outcome depending on the setting of where the surgical procedures are performed. So in 2021, we're pleased to introduce 2 centers of excellence specifically for colorectal cancer surgery and also for spinal surgery. Firstly, for colorectal cancer surgery, we've partnered with centers of excellence throughout the country and have contracted with the hospitals, the surgeons, and with the anaesthetist on the basis of outcomes to ensure quality outcomes for our members. Secondly, for spinal surgery, a similar centers of excellence around the country, again, partnering with the hospitals, surgeons, and the anaesthetists on a value-based basis, but also supporting that with a comprehensive out-of-hospital spinal care program to ensure that members are enrolled in a program that prioritizes conservative care for back pain. Often meaning that if a patient has gone through an extensive program of conservative treatment, outcomes in terms of spinal surgery are significantly better. And we really think these 2 network solutions will make a big difference in terms of the quality of care that our members access in 2021. As in any year, we make some changes and updates to the networks and to the benefits that our members use. Firstly, from a network perspective, we'll be updating the hospital networks in all areas. We'll be adding hospitals to the regions, and in some areas we may be substituting some hospitals, the details of which will be made available in due course. The day surgery network will also be extended to the comprehensive plan, where members of the comprehensive plan will now have certain procedures done in day surgery on a full cover basis, given the ability to perform these procedures in the day surgery facilities on a safe basis and on a day basis, rather than having to be admitted to an acute hospital for the same procedure. For diabetes care, we're also expanding the program and the designated service provider through the Premier Plus GP to the comprehensive plans. And also for members that are enrolled in the diabetes care program, their nominated Premier Plus GP or the Premier Plus GP that enrolled them in diabetes care will also become the designated service provider for the management of their other chronic conditions, such as cardiovascular conditions. This is based on clinical evidence that we have locally and internationally that if a diabetic is looked after by a single doctor, not just for their diabetes, but also for other comorbidities, that the outcomes for that patient is better. And then finally, we're also updating all the limits, co-payments, thresholds, and deductibles for 2021 on the 1st of January. All of these will be increased by between 3 and 4%, with the exception of some benefits, and also with the exception of endoscopies, where we've reduced the co-payment related to endoscopies, where it's done in a day surgery facility, in order to incentivize the appropriate setting for endoscopies going forward. Then the second area where we focused, or the fourth area in terms of trends where we focused on, is improving the access to healthcare for members of the Discovery Health Medical Scheme. Now we know that for many members of the Islamic community in South Africa, membership of a medical scheme is not an option, given that the medical scheme is often not managed in compliance with Sharia principles. So today I'm very pleased to introduce to you the first Sharia compliant arrangement in South Africa for medical schemes. The Sharia compliant arrangement has been designed in conjunction with a group of Sharia advisors and have been signed off by 3 leading Islamic scholars in the area of designing Sharia financial products. These Islamic scholars will also be involved in the continual measuring of the compliance of the arrangement with Sharia principles. Any member of the Discovery Health Medical Scheme can elect to have their plan managed in accordance with Sharia principles through the Sharia compliant arrangement. They'll be able to make that election during the year-end revision process, or for new members joining, they'll be able to make that election as part of the application process. Any member of the medical scheme who does not make an explicit election will be left outside of the Sharia compliant arrangement, and no member's contributions or benefits or claims are affected by the Sharia compliant arrangement in any way, other than ensuring that for those members that elect to, they can have their plan managed in accordance with the Sharia principles. We're excited about this arrangement because it opens up medical scheme membership for so many members of the South African society that have stayed out of medical schemes as a result of this of the shortfall in the administrative arrangements of medical schemes. Then we also know that many members of society cannot access private healthcare, or do access private healthcare, but at a significant cost to them. And to really address affordable access to healthcare, Discovery is pleased to launch Discovery Prepaid Health in December of 2020. Discovery Prepaid Health is a very simple product with the simple aim of making basic primary care available to all South Africans, not just members of the medical scheme. It involves a free-to-use digital platform through which members can purchase access to medicine, a consultation with a nurse at a pharmacy clinic, or consultations with a GP, whether it be in person or virtually. And these services would be available to members and to the broader public at rates that are significantly below the cash rates of the private healthcare market. It's run off a very simple digital platform that's been designed with low data cost in mind. It gives members access to a simple prepaid balance, which they can top up through vouchers that's available in major retail outlets, as well as through Discovery Bank. And members will also be able to use their Discovery Miles to convert these into prepaid healthcare. Members will then be able to select a particular prepaid healthcare service, either use it themselves or share it with others, whether it be employees or loved ones or family members that are in need of affordable access to healthcare. So very excited to share with you today the impact we think prepaid healthcare will have on South Africa going forward. So in summary then, really in response to the trends around improving the quality of care, improving access to healthcare, we're very pleased to introduce a series of enhancements to the benefit of you as our members and to the broader public in South Africa to ensure access and quality healthcare going forward.